Now we will palpate it from one side and from the other. So I palpate the submandibular area. As expected, when we approach the submandibular lymph nodes, as well as the border of the masseter muscle, the tissue becomes denser, fibrosed, and I can no longer freely and unhindered move the fold. From this place in the massage, I will need to work specifically in order to elevate fibrosis and soften the tissue. Checking on the right side, this is where the change starts. We look from the left side. We palpate the tissue millimeter by millimeter on the left side, and the situation is slightly different. Fibrous lumps begin further from the center. This suggests that the spasm in the left sternocleidomastoid is less, and therefore the area of coverage with fibrosis in the tissue is also smaller. Probably the spasm of the masseter muscle on the left is also less. The fingers pass much more easily in the area under the lower jaw and reach the corner of the jaw. Here, a denser spliced tissue already begins, which we will have to massage. The depressor anguli oris muscle. First, you need to determine which side of the corner of the mouth is lower, or where there is more shadow from the corner of the mouth. Then we palpate the muscle from the side where the corner is more lowered. Visually, we determine that on the right side, the shadow from the corner of the mouth was laid a little more. Now we start to palpate the depressor anguli oris muscle in order to confirm our observations. Will the muscle on the right side really be thicker? I am lifting the muscle now. Turn on a little to the side. Here you can see that elements of the spliced tissue. There is also a clamp in the tissue here. I palpate the right side of the muscle to its lower attachment. It is very difficult to lift it closer to the lower attachment. Now I will palpate the muscle on the other side and determine if there is a difference in the sensations from these muscles. We pass to the other side and lift the muscle on the other side. It also shows tissue-to-muscle fusion. This means that the nutrition in this place has deteriorated. It can be noted that the tone of the right depressor anguli oris muscle is higher. This means that when we carry out a massage, firstly we will process the depressor anguli oris muscle on the right side. Now begin to test the zygomaticus major muscle. To begin first, we may proceed with a visual examination. We will ask our model to smile, and then we can observe on which side there is a shortening of the smile line. Then, whilst palpating the zygomaticus major muscle, we will certainly determine that current condition of the muscle whilst crossing the zygomatic ligament. Like you already know, if there is a predisposition towards the SOOF, if from either side of the SOOF is bulging more, then almost certainly whilst crossing the zygomaticus major muscle with the zygomatic ligament, we will face the density of the tissue. Now determined that from the left side, please slightly relax your jaw. Our model has a more toned zygomaticus major muscle. Now I am lifting the zygomaticus major muscle and am feeling it with my fingers. Under my fingertips, I feel that, namely under the situation when crossing with the muscle lifting the corner of the mouth and tissue, in the muscle itself there is a clamp. We are now moving up. When crossing the zygomatic ligament, I can't feel any denseness in the tissue. I can feel the denseness I feel precisely when crossing the muscle that's lifting the corner of the mouth. Now I am palpating the zygomaticus major muscle from the right side. Here I also feel the increase in the tone of the muscles exactly in this spot when I'm going over the area of crossing of the muscle lifting the corner of the mouth. When I move upwards, moving towards the zygomatic ligament, I then cannot feel the large grip of tissue, maybe just a little over here. It is likely that from both sides the large zygomatic ligaments may have the clamping when crossing the muscle lifting the corner of the mouth, which is located right in this region. We have determined that from the left side there's a greater spasm in the muscle. We ask our model to draw from the left side a line with converging arrows. It indicates that in this particular location the muscles are shortening. We also have diagnosed that when crossing this muscle with the muscle lifting the corner of the mouth, there are painful dense areas. From the left side it was more sensitive, a 5 out of 10, and from the right side just a 4. When performing a massage, it is necessary to pay close attention to those areas so that we can massage them and improve the supply in this area. Testing the condition of the small zygomatic ligament. In order to perform that, at first we need to visually find the location of the lowest point under the eyes, and then feel it with our hands. Lightly tilt your head forwards. Visually, we determined that the lowest point under the eyes is located on the right side. If you struggle to see which side, you may close your eyes and with fingers feel on which side the distance of tissue between your finger and the bone is smaller. It can be said that from the left side there is more tissue and from the right side there is almost exclusively a bone. This is a result of a process when the muscle is spasming and the attachment is under a pressure for a considerable amount of time. It is then that the supply weakens in this area. It becomes hollow, fibrosed area. Now I will try to test my guesstimate. I lift the tissue above the small zygomatic ligament from the side where presumably there is a stronger tone. Here is a crossing with a zygomatic ligament. I cannot feel any dense areas under my fingers. I am checking from one side and then checking the tissue above the small zygomatic ligament from the other side. Here is located the labial fold, which we diagnosed earlier. I can work it with some rubbing motion. Pay attention. If we relax the tissue in the center of the labial fold, the movement of the tissue moves here along the oval line. From this, we may conclude that the stiffness in this area moves tissue here, closer to the center. The relaxation of this area allows the tissue to be taken from the center to the sides. I am moving along this fold. Right here on the way, I begin to meet little wisps and formations. I move along the fold from one side and from the other. Right here I can feel the formation of little wisps. I can begin to work these wisps. What do I have here on the bone? First I work the fibrosis on the bone. From one side and then from the other, it is common form, the right side, for there to be a lot and from the left considerably less. Here the model has more dense tissue, and here, as you can see, it is empty. My task is to make the tissue more homogeneous on the surface level, where I am right now, as well as the depth where we have located the muscles, working all the muscles which are entering this tendon. I am working from one side, and from this very corner I am moving along the large zygomatic muscle. Both muscles are coming out of this location, triangular, and here we have the large zygomatic. I lift the tissue from the bone, and now I have the muscle in my hand. When I'm feeling this wisp, I'm feeling that in this place we have a density. I rub this density on the bone, again checking the tissue. Here I still feel the density. The tissue has become softer. My task is to relax this muscle.